Hello, I wanted to offer a little concept that I love to weave into my personal mobility practice week in and week out. And I teach this a lot to patients and clients when they are struggling with any type of digestive issue, whether it's constipation, diarrhea, belly bloat, even things like low back pain or just tension in the back and the hips and the sacral area, tension in the neck and shoulders, bladder issues, so urgency, leakage, like the list goes on. So this concept is rotation. Now, rotation sort of gets a bad rap. A lot of people feel in their bodies uncomfortable with any type of twisting or rotating, or we've been led to believe that twisting and rotating is dangerous. Like that's how we're going to injure our back, right? So depending on your personal experience, you're going to feel different with this, but ultimately with rotation, I love to incorporate this again into my practice and invite others into their own movement practices, is because if you think about all of the digestive organs in your abdomen, digestive organs and other vital organs like the liver, the pancreas, small and large intestine, the uterus, if you're a woman, you still have your uterus, ovaries, bladder, like there's all sorts of things going on. And these organs love to glide and slide over one another. So they don't love to be just like stuck in one spot. And culturally, we live in this culture, if you live in the States, where we're always, because fitness is pretty big here, we're always taught to kind of, tuck and suck in and squeeze and contract. And that just kind of keeps everything in one little spot, right? Where it almost feels kind of tight and rigid and stuck, painful, constricted, like the list goes on. So we want to be able to really expand through that abdominal area and our kind of chest and heart area. So this kind of sounds a little bit like that chambered breath, where we're creating space in these areas of our body so that our body can do what bodies do, right? Just depending on the organ or the body system we're talking about. So with rotation, I always love to especially highlight the liver. The liver is a workhorse for your body. So the liver is constantly kind of, flushing the blood and really checking to make sure anything that needs, converted, sent out of the body or shifted one direction or another. And so it's constantly filtering that blood. So the liver is an organ that loves to be sort of nurtured with movement and blood flow. Okay, so a part of that is rotation. So I always kind of keep that in my mind's eye when I'm doing any type of gentle rotational activity. And again, with breath and with intentionality and moving gently, usually that's the safest route to go. So that way you can be in your body just deciding for yourself, does this feel good? Does this feel different? Does this feel weird for my body? Does this feel painful? Like there's a red flag that I actually need to listen to. So those are some questions that you can kind of feel through when you're doing this. So I'm going to show you an example. If you haven't watched the windshield wiper knees video, or where we're on our back with our knees bent, feet flat, and our legs are just gently, our knees are falling from one side slowly on over to the other, that's an example of rotation for your kind of lower trunk, right? Kind of lower belly, hips, legs. I'm going to show you one for your upper trunk. So kind of upper belly, heart space, shoulders, etc. So I'm going to use a yoga block. If you need a pillow, you can use a pillow as well. This one is going to be done on your side. I call this the rainbow stretch, by the way, and you'll see why. So if you come into kind of a little fetal position, pick a side, any side, because you're going to do both. You're going to use a block or a pillow underneath your head, elongate that bottom arm out, take that top arm, and just kind of sandwich your hands together. So knees and hands are all sandwiched. Now don't worry when they come apart. Your knees can come apart. That's totally fine in this one. So from here, you're going to inhale, take that top hand and sweep it gently overhead. Inhaling all the way open, and then exhaling once you're there. Adjust that block as needed, and you can really start to feel this kind of opening rotation stretch through that upper trunk. Kind of gently maybe inhaling in this position, especially into that kind of heart space and those ribs. And then you can gently rainbow your arm back up and over to the starting position. And then again, just moving intentionally with your breath in whatever way that makes sense for you. For me right now, I'm inhaling up and over, exhaling as I feel through that rotation. Maybe lingering for a breath or two. And then eventually coming up and over. And you can pick your pacing. Maybe you like to just oscillate back and forth where you get a little bit more of a blood flow and circulation sort of practice, or maybe you like this kind of long lingering stretch, sending the breath into the ribs and that liver area. So you can do this on both sides. Again, you can kind of pick your pacing. You can do this in a way that makes most sense for you and enjoy. Again, leave a comment if you feel up to it in terms of how you feel about this, and if this is something that you have incorporated into your movement practice. So more rotation to come in a myriad of positions. You can get creative and have fun with this. All right, we'll see you in the next video.